welcome Dr. Anjali Kumar to the Afro Asia MHM Summit 2021. It is a great honor to have you on board, ma'am. Dr. Anjali Kumar is an MBBS MD in obstetrics and gynecology, advanced laparoscopic and hysteroscopic surgeon. She is director of the Gynac Clinic, Gurgaon, and currently leading the department at C.K. Birla Hospital, Gurgaon, having rich expertise of more than 30 years in the field of gynecology and high-risk obstetrics. She was awarded in 2019 by the Economic Times as an inspiring gynecologist of North India. She is the founder of Matri, a digital platform on women's health.
So, ma'am, what is menopause?
Menopause means periods pause, and perimenopause is the time when a woman is actually heading towards the menopause. So this could be a time which is ranging from 1 year to maybe 3-4 years or maybe up to 10 years. When a woman does not get periods completely for 12 months consecutively, then we say that officially a woman has entered the menopause. So a time when she is heading towards menopause is what is known as perimenopause. This is the time when a woman could be having irregular periods, she could be having weight gain, some mood changes, irritability. Some women complain of vaginal dryness, they complain of urinary frequency. Now, this is the time when the level of estrogen in the body reduces, the number of eggs in the ovary decrease. So, most of these changes are actually very simple. They do not require any treatment, but certain lifestyle measures can definitely help. You must definitely exercise. It's very important to exercise during perimenopause and at the time of menopause to keep your bones healthy, to keep your heart healthy. Make sure that you're taking the right diet, avoid alcohol, avoid smoking. In case your symptoms are too bad, you can definitely take a help with your doctor. Do not forget to take your regular calcium and vitamin D supplements.
Great, amazing, ma'am. So, ma'am, moving on to the second question. What is postpartum depression?
Millions of women globally suffer in silence with postpartum depression. It could simply be baby blues or postpartum depression, or in severe cases, postpartum psychosis. This is a complex mix of physical, psychological and behavioral changes which happen post-delivery. This typically happens post-delivery when there is sudden drop in the levels of estrogen in the body, coupled with the sudden demands of looking after baby, the body image issues which may crop up after delivery. So the woman may have mood changes, depressive mood changes, fatigue, low appetite. She might not be interested in looking after the baby. She might not be interested in looking after herself. In severe cases, she might even have suicidal thoughts. So it is very, very important that such episodes must be brought to the notice of doctors. It has been seen that women who have a history of depressive episodes in the past, who have history of premenstrual syndrome or premenstrual dysphoric disorder have a higher chance of developing postpartum depression. Women who are younger in age or who have twins or children with special needs are more likely to have postpartum depression. So the first thing which you have to do is, number one, ask for help. Make sure that you confide in someone who is willing to listen to your concerns properly. In extreme cases, ask for medical help. We can give anti-anxiety drugs, antidepressant drugs, and all these are very, very safe in breastfeeding too. Lifestyle measures like taking a healthy diet, doing some good physical activity, taking adequate rest also helps in postpartum depression.
Wow. So, moving on to the next question. What are your thoughts on bleeding or spotting in pregnancy?
Pregnancy is a beautiful time of expectation, and 9 months of pregnancy are actually marked by absence of period. So actually there should be no bleeding in pregnancy, but there are some women who actually face the problem of bleeding in pregnancy, and many cases this could be very mild, it could be very benign, doesn't mean anything, but sometimes it could be sign of a serious underlying problem. In first trimester, the bleeding could be simply an implantation bleed, which is when the embryo is trying to implant in the uterus. Sometimes bleeding could be sign of a threatened miscarriage, and sometimes it could be sign of a serious condition which is known as ectopic pregnancy, which is when the pregnancy is implanted in the fallopian tubes and not inside the uterus. In the second and the third trimester, the bleeding in pregnancy could be sign of a threatened premature labor. It could be sign of a placental separation or maybe low-lying placenta also. Sometimes there could be very mild, benign reasons of bleeding, which is the infection in the cervix, maybe a cervical polyp. But the most important part is that in case you ever have bleeding in pregnancy, it's very, very important to inform your doctor and seek the right kind of treatment.
Thank you, Dr. Anjali, for your time and efforts. It was really a wonderful session with you today. We are looking forward for more such associations with you. Thank you.